Now you're going to continue with the acute complication. Okay. Now we need to know that what in the acute complication, the first complication that we have is hypoglycemia. Is it clear? So in hypoglycemia, is the question that you are going to ask yourself is how does hypoglycemia present? Is it clear? So hypoglycemia, the presentation of a patient that has hypoglycemia. When you're hypoglycemic, it means that the brain is not going to be well supplied. But before I go continue in that part, we need to know that what generally there are two major organs in the body that do not require insulin that do not require glucose in order to form, that do not require insulin in order to reabsorb and metabolize glucose. There are two major organs, and those two major organs are the brain and the liver. Basically, the brain and the liver do not actually require insulin for the metabolism of glucose. So that's why when you have hypoglycemia, the first organ that suffers is the brain. Is it clear? And when you have hyperglycemia, the first organ that suffers is still the brain. Is it clear? Because it is the only one among all these that is directly taking its energy source from glucose and without any other source. Is it clear? Except from ketone bodies and all the likes. Is it clear? So it takes directly an energy source from glucose. So when you have hypoglycemia or hyperglycemia, the system that is mostly affected is central nervous system. That's why the presentation is mostly going to be based on the central nervous system. Now, you need to know that what the nervous system now presentation can be divided into two. We have autonomic nervous system signs of hypoglycemia, and we have central nervous system signs of hypoglycemia. Is it clear? Now, the autonomic nervous system signs of hypoglycemia are going to be associated with the sympathetic nervous system activation. And what are the elements of sympathetic nervous system activation? The patient is going to sweat. You're going to have sweating. Is it clear? You're going to have a patient that is agitation. Is it clear? And you may have also a patient vomiting. Is it clear? So those are the signs of the sympathetic nervous system activation. Is it clear? Signs of sympathetic. You have also hypersalivation. Is it clear? Hypersalivation. So all those are the signs of sympathetic nervous system activation. Now, the central nervous system signs of hypoglycemia. When you are hypoglycemia, the brain does not function again effectively. You are going to have things like confusion. Generally, patient is confused and the patient may lose consciousness after confusion. The patient may be dizziness, and we have things like blurred vision, basically, and sometimes you may have headache. Is it clear? So generally, those are the signs of hypoglycemia. Is it clear? Now, the next thing is how do you diagnose now hypoglycemia? Hypoglycemia. To diagnose hypoglycemia, you use now what is called the Whipple's triad. Is it clear? You use the Whipple's triad. Now, what is the Whipple's triad? Now, the first element inside the Whipple's triad is that what? So you have a patient that has a fasting blood sugar of less than 50 to 55 milligram per deciliter. A random blood sugar, a patient having a random blood sugar of less than 50 to 55 milligram per deciliter. Is it clear? And now with signs and symptoms, is it clear? With signs and symptoms of hypoglycemia. Is it clear? And what are those signs and symptoms of hypoglycemia? These signs and symptoms that are just listed, which is relieved when the patient takes glucose. Is it clear? Which these signs are relieved when the patient takes glucose. It means that it is hypoglycemia. Is it clear? So that is the diagnosis. We use the Whipple's triad. The first element of Whipple's triad is that what you have a patient with a fasting blood, a random blood sugar. It's not fasting, random blood sugar of less than 50 to 55 milligram per deciliter, having signs and symptoms of hypoglycemia, and with a when which is relieved by using glucose. Is it clear? This Whipple's triad with 50 to 55 is mostly in patients who are non-diabetic. Is it clear? Generally, non-diabetic patient, we can take the fasting blood sugar for Whipple's triad to be 50 to 55. But generally, when you are diabetic, the fasting blood sugar for you to consider the Whipple's triad is less than 70 milligram per deciliter. When it's already less than 70 milligram per deciliter, patients who are diabetic are already having signs of hypoglycemia, and which is relieved by glucose. Why? Because their body is already adapted with a very high level of glucose, and when they already go by level of 70 milligram per deciliter, it's already an alert. Is it clear? So now that is for hypoglycemia. Now the next thing to visualize now is going to be the HONC, hyperglycemic hyposmolar non-ketotic state. Is it clear? So So that is the honk. So hyperglycemic hyperosmolar non-ketotic state. Now for the hyperglycemic hyperosmolar non-ketotic state, the first element that you have is hyperglycemia. Is it clear? So hyperglycemia. So the first thing is that you first have the clinical evaluation, your physical signs of hyperglycemia. Is it clear? Generally, the signs of hyperglycemia are usually on the central nervous system, and you need to know that what, since there is excessive glucose inside the blood, and I've told you generally the cells of the body other than the brain and the liver do require insulin for their activation with glucose. Is it clear? For the activation with glucose. But now you need to know that what, there is excessive glucose, but there is either insulin resistance or no insulin for the other cells to use the glucose. So it means that the brain is going to be excessively using the glucose. Since the brain uses excessively the glucose, it's going to be hyperactivated. When you have hyperglycemia, generally in honk, the cells are going to be hyperactivated, and when the cells are hyperactivated, you usually have convulsion, is it clear, at the beginning, and then at the end you have loss of consciousness. Is it clear? Is it clear? That is generally how hyperglycemia in honk presents, because of high electrolyte level. You first have convulsion and then you have loss of consciousness. Is it clear? That is how hyperglycemia presents in honk. Now the second element in honk is that you have a hyperosmolar state. Is it clear? Now when you have that hyperosmolar state usually presents with a dehydration. You have dehydration in hyperosmolar state, and you have hypertension. Is it clear? Now the question is, why is it that the patient is dehydrated but is hypertensive? The patient is dehydrated but hypertensive but because he has a hyperosmolar state. And now the question that I'm going to ask you, in honk, what results with the hyperosmolar state? You need to know that what, when you have that high glucose level, is it clear, normally we need to know that what, glucose has to be present in the intracellular fluid. Is it clear? While in the extracellular fluid, in the intracellular fluid we normally have glucose, potassium and proteins, while in the extracellular fluid we normally have sodium chloride and blood proteins. Is it clear? So that is what is going to maintain the ions that maintain a different fluid. Is it clear? But now you need to know that what, you need to know that glucose is not going to be intracellular because of lack of insulin or insulin resistance. So you are going to have high accumulation of glucose in the extracellular fluid. You have again sodium ion in honk. Sodium ion is going to increase highly in the extracellular fluid. Is it clear? Sodium ion increases highly in the extracellular fluid. Is it clear? So you need to know that you have glucose, you have sodium ion, which are very high in the extracellular fluid. So it means that what, since they are very high in the extracellular fluid, they are going to